hospital. The women of this village pooled their small savings to buy 2 goats, agreeing together to raise a herd. 2 years later, they have more than 100 goats.
And sometimes when you have a child who is very sick and you can't afford, you sell a goat. It's easy to sell a goat and get money and take the child to the health center.
In one community, the men and women banded together and are building a road.
We are constructing this road to be able to access services. Want to be able to take our children to the health center in case they are sick, our wives when they need health services, and to be able to sell our produce from our village.
Leadership for the project comes from Mbarara University, here to stay. Healthy Child Uganda also improves facilities for children at local health clinics and supports training for health workers and Ugandan university students. Students have the chance to work alongside communities, learning and sharing what they know during placements in Healthy Child Uganda villages.
Do some field practice for about 3 weeks, and it has been helping them. Our population in the country, 80% of the population are rural, and we take these students to rural setting. So that's an initiative where they are already getting to learn in the environment where they will be working.
The project is more of an educational project. It educates people on how to go about the challenges they meet in as far as child health is concerned, both in the community and of course in the university and eventually in the hospital.
When you look at the areas of operation, you find the indicators of nutrition, of malaria, indicators of respiratory tract infection, indicators of sanitation and hygiene, in the coverage with immunization rates, the 8 killer diseases we address, we have seen a significant, statistically a significant increase. So I think I appreciate what this project has done, and we are trying our best to actually include it in our district health system to become permanent practice. Not only the district health system, even to the national health system, because the approach was innovative, has worked, and we can duplicate and replicate it.
Healthy Child Uganda is successful because committed partners, a dedicated volunteer network, and communities work together for real change. Since 2006, volunteers report an astounding 40% decrease in child deaths in their villages. Communities are grateful and are on board.
Healthy Child Uganda is the savior in this village. When the cops were trained, they came back and discussed with us hygiene. Now we all have clean latrines. Recently they even gave us bed nets. Now we have even learned that we are supposed to sleep under treated bed nets.
Healthy Child Uganda is extremely low cost, using education, volunteer spirit, and empowerment to make a real difference in child health.
Our overall goal with this project is to develop a model for delivering health to children that can work in rural communities and uses volunteers and uses the resources already available in communities. Our vision is that this model might be applied other places in Uganda and sub-Saharan Africa.
It's concrete, it's real, we see the impact child by child. But in terms of what we need to be looking at in terms of helping Uganda further would clearly be to how do we scale up? How do we bottle the success here and take it through the rest of the country?
They have helped us to improve the health care of our population, and we hope that the support from Canada will continue so that the health of our population will be improved.
Now, Healthy Child Uganda wants to expand to new communities that have desperate need and want help. Too many Ugandan children still die every day. Healthy Child Uganda has proven it doesn't need to be that way. Making big change is neither expensive nor impossible. Committed volunteers, communities who want change, and a team willing to support them with tools and education can help keep children not just alive, but thriving. Healthy Child Uganda is a happy story about Africa, about Ugandans helping themselves, about healthier children and healthier, empowered communities making real change. Healthy Child Uganda, improving child health through community education and empowerment.